Avoid breakfast if you have these health problems. Salmon is known for its superfoods and is considered a superfood because of its high levels of omega-3 fatty acids, vitamins, and minerals. Very important, eating regularly has been linked to many health benefits, including improved heart health, reduced inflammation, and improved brain function. Despite these proven benefits, salmon may not be right for everyone. Some health conditions are made worse by eating breakfast, which some people avoid or eat with caution. Salmon's benefits are linked to its high levels of omega-3 fatty acids, which are known to support heart health and cognitive function. In addition, salmon is a good source of protein, vitamins B12 and D, and selenium, all of which are important for maintaining overall health. However, these benefits are overshadowed by potential risks for those with health conditions. Factors such as mercury pollution, thyroid disease, purine content, and high protein can influence the right choice of salmon. For those with certain health conditions, such as mercury sensitivity, thyroid disease, or autoimmune disease, the benefits of salmon may outweigh the risks. For example, although salmon contains many important nutrients, it also contains environmental toxins such as mercury that pose health risks, especially to vulnerable populations. Additionally, certain compounds in salmon can interfere with thyroid function or worsen autoimmune disease. Knowing these risks is important when making dietary choices. In this discussion, we will look at the reasons why you should avoid snacks if you have health problems. From mercury sensitivity to thyroid disease, from gout to autoimmune diseases, each disease has its own unique considerations. It looks at how these factors can affect your health when it comes to snacking, and offers advice on how to manage your diet properly if you fall into any of these categories. By researching potential deficiencies and knowing how they interact with specific health conditions, you can make informed decisions about including salmon in your diet. Consider these considerations carefully to help you decide if salmon is a safe and beneficial food for your health needs. Year 1. Heart to mercury. Emily likes to eat snacks for lunch at least twice a week. This is her recipe for a quick and healthy lunch. However, he started having headaches, numbness, and a strange metallic taste in his mouth. After going to the doctor, he discovered that he had high levels of mercury in his blood. A study published in the Journal of Environmental Research found that regular consumption of certain types of fish, including salmon, increases the level of mercury in the body. Mercury is a neurotoxin that affects brain function and development, especially in children and pregnant women. If you are sensitive to mercury or have suffered from mercury poisoning, it is important to limit your consumption of salmon. Choose fish with less mercury, such as sardines, anchovies, and salmon. Just a reminder that we have included all the scientific studies mentioned in the video description. Number 2. Diseases of the tank. Linda battled hypothyroidism and included salmon in her diet because of its high iodine content. However, her thyroid levels remained normal. Her endocrinologist identified some types of salmon as goitrogens, which can cause thyroid problems. A study in the Clinical Journal of Endocrinology and Metabolism found that eating goitrogenic foods can disrupt thyroid hormone production, especially in people with thyroid disease. If you have thyroid problems, be careful with salmon. Make sure you are getting the salmon from reliable sources that are not affected by fish diseases. Third year. Gout. Michael, who suffers from gout, noticed that salmon was introduced into his diet and his inflammation worsened. Her rheumatologist told her that salmon, like other fish, contains purines, which can make gout symptoms worse. A study in Arthritis and Rheumatology shows that a diet high in purines increases the level of uric acid in the blood and increases the risk of gout. Salmon is low in purine, so it can stimulate the central nervous system. People with gout should limit their intake of purine-rich foods, including snacks, to help control symptoms. Now, I'm going to show you how to eat salmon properly so that you don't have to worry about the problems associated with it and just reap the benefits of this amazing food. Without this information, there is no point in watching the video at this point, so be careful. Instructions for safe use. 1. Choose wild game over farmed. In general, the food is better quality and less contaminated. 2. Monitor portion sizes. Keep snack intake within the recommended range, especially if you have health conditions that can be exacerbated by overeating. 3. Exercise. 4. Cook the blanket properly. The blanket should be thoroughly cooked to avoid food poisoning. 5. Consult a health professional. Always talk to your doctor about dietary changes, especially if you have an underlying medical condition. Although salmon is a great food with many health benefits, be aware that it may not be for everyone. Despite its reputation as a superfood, some people should be careful when approaching salmon or avoid it based on their health conditions. For those who are sensitive to mercury, the risk of elevated mercury levels from regular consumption of salmon can cause health problems. Mercury, a toxic element, accumulates in the body and affects various systems, especially the nervous system. If you have been exposed to high levels of mercury or are allergic to this substance, it is important to choose low-mercury fish and monitor your seafood intake to protect your health. People who are allergic to fish face a different but equally serious problem. Allergic reactions to fish proteins can be serious and life-threatening, causing symptoms such as difficulty breathing, swelling, and anaphylaxis. For someone with a known fish allergy, it is important to avoid salmon and other fish products to avoid allergic reactions. Patients with heart disease and high blood pressure should consider the source of salmon. Although salmon is rich in heart-healthy omega-3 fatty acids, it often contains high levels of saturated fat and unhealthy fats that can counteract the benefits. Choosing wild-caught salmon and monitoring your intake will help you get the benefits without the hassle. For those with autoimmune diseases such as lupus and rheumatoid arthritis, the antioxidant properties of omega-3 in salmon can sometimes irritate or worsen the signs. It's important to work with your healthcare provider to find the right balance of omega-3 intake and monitor the effect of salmon on your health. The problems of diabetes and insulin resistance complicate the snacking debate. Many unhealthy fats and pollutants can affect blood sugar control. Choosing wild-caught salmon and monitoring blood sugar levels can help alleviate these concerns. If you have kidney disease, the high protein content in salmon can cause kidney problems. For people with chronic kidney disease, controlling protein intake is important to slow the progression of the disease and maintain kidney function. It is generally advised to limit salmon and other protein-rich foods. Thyroid disorders, including hypothyroidism, can be affected by goitrogenic compounds in salmon, which can disrupt thyroid function. For people with thyroid disease, it's important to check with your healthcare provider to make sure your diet supports optimal thyroid health. People with gout should be aware that the purine in salmon can increase uric acid levels and worsen inflammation. Adjusting your diet and choosing foods that are low in purines can help manage gout symptoms. In summary, although salmon is a healthy addition to many foods, the diet should be tailored to the individual's health needs. If you have any of the conditions above, it is important to consult a health professional before making any major changes to your diet. They can provide personalized advice on how to safely include salmon in your diet or suggest alternatives that may suit your health needs. For those who are unsure of their health needs and how salmon should fit into their diet, the best solution is to consult a nutritionist or doctor. They can help you navigate your food choices so you can enjoy the benefits of the blanket and minimize the possible risks. By keeping these ideas in mind and taking steps to manage your diet, you can enjoy a balanced and mindful approach to eating, whether it's salmon or other food choices. If you found this information useful and want to know more about foods with hidden side effects and health problems, I have created more information for you. Click here to find out and increase your understanding of choosing the best food for your health. Number 4. Autoimmune diseases. Sarah, who has lupus, was advised to eat anti-inflammatory foods. He added salmon to his diet, but found his symptoms worsened. Her rheumatologist explained that certain compounds in salmon can trigger inflammatory reactions in people with autoimmune diseases, Research published in Autoimmunity Reviews shows that the high levels of omega-3 fatty acids in salmon can sometimes worsen the symptoms of autoimmune patients by exposure to function of the dead cell. For those with autoimmune diseases, moderation is important. Consult your healthcare professional to find out how much salmon to include in your diet without harming your health. Fifth year, kidney disease. Eleanor, who suffered from chronic kidney disease, was advised to follow a low-protein diet. He loves salmon, but he noticed that his kidney function was damaged by eating it regularly. His nephrologist explained that the high protein in salmon was affecting his kidneys. Research in the American Journal of Kidney Diseases suggests that high-fat foods can accelerate the development of kidney disease. Salmon is a high-protein food, and this can be beneficial when eaten in large quantities. Patients with kidney disease should limit their intake of protein-rich foods, including junk food, to protect kidney function. Consult a health professional to determine a safe amount. Number 6. Diabetes and insulin sensitivity. Carlos, a diabetic, included salmon in his diet to control his weight and blood sugar levels. However, he noticed a difference in blood sugar levels after eating. His nutritionist said some farmed plums are high in unhealthy fats and impurities. A study in Diabetes Care found that eating farmed fish, including shellfish, increases the level of insulin resistance due to harmful environmental toxins such as dioxins and PCBs. Diabetics should be careful about the source of their salmon. Choose a wild game snack and monitor blood sugar levels regularly to avoid dips. Number 7. An allergy to fish protein. John has always loved seafood, but one day after eating grilled salmon, he developed an allergic reaction. His throat was swollen and he was breathing heavily. An emergency visit to the hospital confirmed an allergy to fish protein. According to research in the Journal of Allergy and Clinical Immunology fish allergy is one of the most common food allergies in adults. Proteins in fish, such as parvalbumin, can cause severe allergic reactions in people who are allergic to them. For those who are allergic to fish, even a small amount of salmon can cause severe allergic reactions. If you have this disease, it is better to avoid all kinds of fish and fish products. 8th year, heart disease and high blood pressure. Margaret, who suffered from heart disease, included salmon in her diet because of its heart-healthy properties. However, he found that his blood pressure was still high despite his efforts. His doctor pointed out that he was eating an agricultural breakfast, which often contained unhealthy fats. A study in Circulation found that there may be higher levels of pollutants, such as PCBs, and harmful omega-6 fatty acids, which can inhibit the benefits of omega-3 and have negative effects to heart health. If you have heart disease or high blood pressure, it is important that you choose a wild game snack over farmed salmon. Wild salmon is healthier with fewer contaminants and higher omega-3 fatty acids.